Last week, the reopening plan. This week, many questions about how it's going to happen and when those all important second vaccine doses will start rolling out. With us now for more in the provincial capital, Dr. Isaac Bogoch, infectious diseases physician at the University Health Network and a scientist based out of Toronto General Hospital and the University of Toronto. And Cynthia Mulligan, journalist and political specialist at CityNews. Hello, welcome back to you both.
Thank you. Good to see you again.
So lots of questions to get into in the next 20-something minutes. Cynthia, I want to start with you. Several provinces have released their reopening plans. BC and Alberta's plans have made a lot of us in Ontario slightly envious. Right away in BC, indoor dining is resuming, which is on Ontario's plan for late July. So we have to wait a little bit longer. And in Alberta, when 70% of people have their first dose, basically all restrictions will be gone. In Ontario, we have to wait until at least June 14th for outside to open up, as the kids would say. So Cynthia, why is the provincial government in Ontario being much more cautious now?
Well, because I think they've been burned, Nam, in the past. And we saw at Christmas, the Science Advisory Table was encouraging them to lock down the province before Christmas. They waited to do it until 6 days after, which caused a lot of controversy. And of course, we saw that there was a spike in cases because they didn't shut down the economy. People were going out. So they were burned then and took a lot of criticism for that. And then, of course, we saw just as the second wave was starting to ease, but hadn't really been conquered, and there were dire warnings of imminent disaster if we opened up early, that the third wave would be brutal. Well, they didn't listen to the Science Advisory Table. And of course, we saw that the third wave was indeed brutal. So I think they are being incredibly cautious. And I'm also going to say, keep in mind that almost a year from now, just over a year from now, we're going to have an election. And everything that we see from here on in, yes, it's going to be dealing with a pandemic, but it's also with the mind that everything that they do and they say will be used against them if it doesn't go well on the campaign trail. And they are desperately trying to avoid that.
And, Cynthia, you do cover this stuff in politics. We know a year is like a lifetime. And Dr.
Yes.
Bogoch, we're year 2 of the pandemic, and it feels like a lifetime, and people are really eager to go back to what we consider to be normal. But no one wants to go back to where we were at the height of the third wave. Quebec has a regional approach to reopening where some areas can open earlier. Ontario has a one-size-fits-all plan. Does that make sense?
I think a regional approach is very reasonable when you're dealing with giant land masses, but the problem is your regions have to be reasonable as well. So for example, you got to treat a mega city like a mega city. We treat Peel as different than Toronto, as different than York. For example, you have this imaginary street, Steel, that separates, York from Toronto, and you can have vastly different policy on both sides of the street. Like that doesn't make any sense. But on the other hand, if you truly take a regional approach and create your regions in a meaningful manner, I think a regional approach is warranted, because you can certainly have vastly different epidemics in different parts of the province. And, your policy has to be reflective of what's happening on the ground. Otherwise, you start to lose the general public. People say, well, this doesn't make any sense. We have no cases of COVID. Why are we, for example, locked down, or our schools are closed, or anything like that? And I really think that you can do this in a regional manner, but of course, pick your regions in a smart way.
I think one of the problems before was when certain areas in the province were locked down, people from the regions that were locked down would travel to other regions. So maybe that's one of the reasons. But I think every day we get a lot of numbers to paint a picture of where we stand in this pandemic. We get the number of vaccines given, the number of new cases, people in the ICU, and how many people have died. Dr. Williams has said repeatedly that reopening depends on the number of daily cases going down. But we still have a lot of families mourning their loved ones who have died from COVID. A family in Ontario right now is mourning the death of their loved one who died after getting the AstraZeneca vaccine, and they developed the rare blood clot. Dr. Bogoch, I want to ask you and Cynthia both this question. Are we focusing on the wrong numbers? Should we really be focusing on ICU and deaths instead of new cases? Dr. Bogoch, I'll start with you.
So I wouldn't say there's one metric. You really have to look at several different metrics that paint a more holistic picture of what the ground truth is. One of them is going to be some sense of the community burden of COVID-19, be it your daily case count, your 7-day average, your percent positivity, the number of tests that were done, basically several metrics that represent the burden of COVID-19 and the trajectory of COVID-19 in your community. The second thing is vaccines. You can't ignore vaccines. They're transforming the epidemic here in Canada, and they're transforming the epidemic in other places of the world that are lucky enough to have access to these vaccines. Israel, United Kingdom, USA, and Canada is just starting to realize the benefits of this. So you have to look at vaccine access, vaccine rates, and that's extremely important. The third thing is hospital capacity. You can't ignore it, right? There's no point in reopening if you have no wiggle room in your hospital. And for example, we saw these shutdowns in wave 3 that were largely, but not exclusively, driven by very limited ICU capacity, right? When we look at the ICU capacity, for example, in wave 2, we reached a high watermark of 420 patients in the Ontario ICUs with COVID-19 related issues. Wave 3, it got up to as high as 920. Like, that's a staggeringly high number. It impacted the entire province. People were being shipped to different parts of the provinces for different parts of the province for ICU care. Scheduled surgeries were shut down because we needed all hands on deck. I mean, the third wave was extremely challenging. Everything, all the metrics that we just discussed are headed in the right direction. All of them are. Some of them are faster than others. We've gone from 4,400 new cases per day to about 1,000 new cases per day. But the ICUs, even though they're decompressing, they decompress very, very slowly. We're at around 600 and low patients in ICUs in Ontario with COVID-19 related illness. That's a lot. Remember, the high mark from wave 2 was 420, and we're still in the 600s. It's going to get better. It just takes time to get better. So really, a holistic approach looking at multiple metrics to paint a better picture of what the true burden of COVID-19 is in the province will be necessary before you move forward. You can't just pick one or two.
And Cynthia, I want to ask you that same question. And I noticed that early on in the pandemic, when the health minister, Christine Elliott, would post these numbers on on Twitter, she wouldn't post how many deaths. And I noticed that you were one of the people who led the charge and posting the deaths. First, why did you do that? And if you could also add on to what I just asked Dr. Bogoch.
Well, I think that the deaths need to be acknowledged, and I think they need to be acknowledged every day. And yes, you can hunt for them in the numbers, but I personally do feel that it comes across as a little bit cold that the minister isn't acknowledging daily how many people have died. And many people who have had loved ones die have said to me, emailed me that day, by the way, thank you, because my grandmother, my mother, my father is in that number. And I think that we really do need to acknowledge them. And I think that the government is not ignoring them, but also trying not to put them in the forefront because they probably think it makes them look bad. Now, I completely agree with everything Dr. Bogoch just said about looking at all the numbers. And if you look, our daily total, our 7-day average has dropped by 60% since the beginning of May. And there's a lot to celebrate there. I know that the government is watching these numbers very, very carefully, and their target to start phase 1 of the reopening, the gradual reopening, is around June 14th, they said. But I do have it confirmed from a senior government staffer that they're looking at that very carefully to see if, and I stress if, they can start that process a little bit sooner. And I asked Dr. Williams, the Chief Medical Officer of Health, just yesterday, is there any possibility? And his answer was, well, he'd like to see the daily average drop to 500 or 600 a day before they start that phase 1. But this government is under a lot of pressure. I mean, there's a real deep divide here, and it's growing deeper every day on should we open, should we not, should we open schools, should we not? And this is a government that has a conservative base that a lot of them are in rural communities, and they want to see things open more because they're not impacted the way the GTHA is. So it's a
And again, that would make sorry, I was just going to say that would, I guess, would make a case for maybe a regional reopening, no?
Yes, but it's as Dr. Bogoch explained, it's not that simple or that easy. And you have people who are dying for a haircut, so they'll drive 2 hours to go get a haircut. As you can see, I need one, and Dr. Bogoch was saying he needs one as well.
Same. I need my hair. Oh my gosh. There's been a lot of criticism too about the handling of first doses in Ontario, the focus on age over risk levels, the lack of a central system for booking. Um, Moving forward, Dr. Bogoch, should some risk levels, i.e., hotspots, high risk illnesses, severe mental illnesses like schizophrenia, should they be prioritized at some point over age, especially as we think about how to roll out the second doses?
Yeah, so obviously this is always going to be a contentious issue. And just starting from first principles, it's extremely important to approach this from a data-driven standpoint and from an equity standpoint. And if we approach this through a data lens and an equity lens, sort of coupled with a medical and a public health lens as well, I think we'll be doing something right. Now, let's look at what was done with first doses, and then let's look at what's going to be done with second doses. First doses, the big priority initially was vaccinate those at greatest risk of having a severe outcome, those at greatest risk of getting this infection, and essentially prioritize based on that. So what did that translate to? Well, many of the provinces didn't veer too far from NACI for the very, very first doses. We vaccinated those in long-term care, which was quite frankly responsible for thousands and thousands of deaths during wave one. Then again, thousands and thousands of deaths during wave two. Look at wave three, nothing, crickets. Long-term care was protected. And can you imagine if you had variants of concern ripping through the long-term care facilities in Ontario? We already saw that once with Roberta Place. The mortality was sky high. It was just awful. I mean, had we not prioritized the long-term care facilities, this would have been responsible for thousands and thousands of more deaths. So, prioritize based on vulnerability, prioritize based on risk of getting this infection. And when you saw the first phase of the vaccine rollout, yep, those in long-term care were vaccinated, Indigenous communities were vaccinated, frontline healthcare providers were vaccinated, and then community dwelling seniors started to get vaccinated at the tail end of phase one and then into phase two. Phase two really prioritized, first of all, you have more vaccines so you can expand the scope of the vaccine program. And phase two really saw a couple of things. Number one, still vaccinating based on risk. So there was high risk medical conditions. So people at greater risk of getting this infection got priority access. People who are at greatest risk of having a severe outcome, for example, with high risk medical conditions and age, got priority access. And then we saw vaccines poured into neighborhoods that were disproportionately impacted by the virus, right? These are the communities that are bearing the brunt of the virus and are bearing the brunt of policies that curb the virus. So they're getting a double hit. April saw 25% of vaccines poured into those communities. In the first half of May, saw 50% of the vaccines poured into those communities. And when you look at the data from this, just like cold hard data, proportionately more people, actually a lot more people in those hotspot neighborhoods have been vaccinated compared to people outside of those hotspot neighborhoods. Great. And then lastly, essential workers, right? Programs to vaccinate essential workers, not just getting people to the vaccine clinics, but bringing vaccine programs to essential workplaces. And again, pop-ups and mobile clinics to vaccinate in high burden areas to lower barriers to vaccines. I mean, listen, it's never going to be perfect. Yes, there are definitely hurdles along the way. There's things that have gone unwell that were avoidable. I think it's also fair to say that there's some things that have gone very, very well. Especially, I'm pretty happy about the equity piece. I'm also pretty happy about the pace of vaccination when we look at, on average, about 135,000 vaccines are administered per day with a peak of close to 190,000 vaccines administered in the province per day. So certainly some things are going well, but by all means, there certainly is room for improvement.
Just to push back a little bit on that equity piece, and I think a lot of that had to do with people, advocates pushing for that in certain hotspot areas. And Cynthia, I want to ask you this: why do you think the province hasn't?
I don't mean to
Yeah, sure.
but I just think it's an important point to clarify. The hotspot. Just remember, when people don't remember this, but this was publicly available on the provincial website, I believe as early as January or early February at the latest. It literally said word for word on the website, I have it all, that says in phase two, we are going to vaccinate racialized communities and communities that are disproportionately impacted by the virus. That was the plan all along. And then it was operationalized when we had access to more vaccines where you could expand from phase one into phase two. So maybe it didn't receive a lot of attention, but just so people are aware, that was the plan. and then the plan was implemented, and the plan
Well,
worked.
and Cynthia,
Dr. Bogoch is absolutely right. That was in the plan. I just think too many, it felt that it just wasn't implemented fast enough, particularly in Peel. That was just the hot zone where you have so many people working in close quarters that can't afford to take time off. And that gets us into the paid sick days, which is a whole other issue. But it did feel like people in hot zones who were particularly vulnerable were not getting high enough priority fast enough.
and this past Wednesday, a pop-up clinic in the Kensington Chinatown neighborhood that was set up for people to get their first dose. This pop-up clinic was actually flooded with people from outside that neighborhood. People came away as far as Thornhill, and they wanted to get their second dose. It's been reported that these people were aggressive with staff and those in line to get their first vaccine. With everyone wanting to get back to normal, are you both worried that we're going to be hearing more and more about these types of incidents happening?
Well, there is a new term, vaccine vultures. And it was a disgusting display and very, very distressing. And I saw it unfold on Twitter, and our station did a story on it yesterday, Shauna Hunt did. And it's disgusting. And they were bullies and treating people very badly and taking advantage of them. You know, we saw it at the beginning when that wealthy couple flew into a community and pretended to be working there, you know, and flew out in their private plane. So, you know, it's just a horrid display of the basest of human nature.
And Dr. Bogoch?
Yeah, I completely agree. I mean, you saw that unfold in the Kensington Chinatown area. Yeah, it's really unfortunate to watch that happen. I think my question though is, okay, obviously that happened, fair, bad, you know, but you know, to what extent is that happening, you know, to that degree all over the province? And just the answer is, I don't know, but you know, as we speak, the province is parlaying a second dose strategy, which will have policy for, you know, how people can get a second dose, when people can get a second dose, logistics of organizing a second dose. And, you know, hopefully that quells some of this type of behavior, because there is, you know, expected, areas and times for people to get their first dose and for people to get their second dose. And with solid communication from all fronts demonstrating, you know, what are the timelines, who's eligible, where can you go, how can you sign up, I think we can avoid a lot of this moving forward.
I mean, I think this government has been accused a lot for lack of communication, because it's been 2 weeks since the people who have received the AstraZeneca vaccine, we found out that we wouldn't be able to get our second one. And the people, I was surprised, a lot of people, I posed this question on Twitter, a lot of people were saying, I want to get my second AstraZeneca. And there's been a push to get AstraZeneca doses into arms before they expire. One report says that more than 100 pharmacies in Toronto alone haven't received their promised supply of doses, and some say that they haven't been instructed who to give them to. These vaccines are expected to expire in a few days on May 31st. Dr. Bogoch, are AstraZeneca doses going into the garbage next week?
So I could speak to this. So a couple of points. Nuance is important and details are important here. Let's start with the first principle, that it would be unacceptable to have any doses expire. That would be unacceptable, right? It would be. I think everyone can agree on that. AstraZeneca was administered in primary care and in pharmacies. Let's just talk about the pharmacies for a second. There's about 1,400 pharmacies all over the province that were administering AstraZeneca. Great. People who got AstraZeneca in a narrow time window in early March are eligible. If they choose, if they want, they can get a second dose of AstraZeneca. But AstraZeneca was available only in a few select locations in the province during that window in early March. Okay, so what the province did was they said, okay, let's bring back all the AstraZeneca from all over the province and let's put it into those areas so that people who choose to get a second dose of AstraZeneca can get a second dose of AstraZeneca. Great, easy to say, but you know, as always, there's logistics. When you're bringing a vaccine back into a central location, you have to do a quality check. It's not anything fancy, but you just have to make sure that the temperature was at a reasonable temperature the entire time. And there's temperature logs and stuff like that that just need to be looked at. You can't have, your AstraZeneca sitting in the back of a truck with the refrigeration system off, and it's 40 degrees in the back of a truck.
Dr. Bogoch, I totally
gonna...
understand this, and I don't want to jump the gun a little bit, but
yeah.
If the idea is to get as many vaccines into the arms of as many people as possible, wouldn't the government have already made a plan to make sure that these vaccines weren't wasted? Forget temperature, all that stuff that happens behind the scenes. But if the plan is to get as many of people vaccinated, wouldn't you already be set up for this?
So where I'm going with this is, it's now been administered, or now been, as we speak, and actually as of yesterday, many of them have now been relocated to the pharmacies that will be administering them in those locations. Again, I'm not excusing it. I think it has been communicated ineffectively, and it has been unnecessarily chaotic. But two things are, let's just look at what's happening and then attach a value judgment. You can go on the provincial website, you can click a button that says AstraZeneca, and you can see a list of pharmacies that have the AstraZeneca available, and you can contact those pharmacies. Like, you can do that. I'm not saying it's easy.
No, I have done that.
Smooth,
I don't want to. I
that.
really don't want to push again, because I've done that. That website is terrible, and I know that the premier has said it's
I'm not
easy to use.
excusing the website at all. I'm just saying that
it's not. And I only have like 2 minutes. I only have 2 more minutes, and I really want to ask you and Cynthia one more question. Dr. Bogoch, if people who had the AstraZeneca vaccine, they don't know what's happening next. They don't know if they can get another one, or when to get another one, or if they can get a Pfizer or Moderna. What do we know at this point about the effectiveness of just getting one dose?
Not acceptable. You need 2 doses of a vaccine. Here's what's going to happen. People can get the second dose of AstraZeneca, and you're going to, so I know we're running out of time, but it's important to state this. Everyone's getting 2 doses, right? That's a given. Everyone's getting 2 vaccines. So for those who got a first dose of AstraZeneca, great. You got a good vaccine. We already know from the data from the UK that it provides very good protection. Of course, you still need 2 doses. You can either get a second dose of AstraZeneca. Here's a window of opportunity to get it a little bit sooner, but everyone's going to get a second dose, and we know that. And the other thing is NACI is going to discuss, I think Thursday of next week, their opinion and their recommendations for mixing and matching. So I think by Thursday of next week, we'll have a good understanding of what NACI says for guidelines for mixing and matching. For people who are dead set on getting a second dose of AstraZeneca, great, you can get a second dose of AstraZeneca. For people who want to wait and say, well, I want to hear what NACI says about AZ versus mixing and matching with the mRNA vaccine, we'll probably know next Thursday, and the policy will align with NACI. But I think the fundamental principle is everyone's getting 2 doses. It's as simple as that.
Thank you for clearing that up for us. Like, we've had a lot of questions about what's happening next for people who've had the AstraZeneca vaccine. And Cynthia, no pressure. We only have 1 minute left.
Okay.
We've been hearing a lot about school reopening or not reopening this past week. The Premier Ford sent out a public letter to children's hospitals, medical experts, and health organizations asking them for a consensus on whether we should reopen schools. What did you make of that letter, and also where the Premier stands on the issue?
Well, I would say it was an uncharacteristic letter. This is not a premier known for getting wide consensus from, education unions and a whole bunch of people. And he's been largely criticized for not following scientific advice. So it was an interesting change. I think he's trying to protect himself for the election that I was talking about a year from now, because if he reopens schools and one child gets really sick, or their parent or a teacher passes away, he's going to wear that, and he knows it. But there seems to be a certain amount of uncharacteristic paralysis here, and he's been widely mocked for not being decisive and having an announcement about having an announcement about having an announcement. So I think he needs to make a decision very soon, or the decision is going to be made for him because it's the end of the school year.
And Dr. Bogoch?
Regional. Simple as that. Do it regionally, right? Huge province. Some places are going to be much better prepared to do this than others. I think it's fair to have the local medical officers of health who know their area well. The areas they represent, they know best, and they know the factors in their area. I think it's a very reasonable thing to have this as a regional decision.
Or maybe even end early, because report cards go out on June 10th, right? I mean, I'm saying that as a parent, so I'm not an expert. Cynthia, what are you hearing from people?
It's a deep split and it's very wide, and it's an emotional issue. We did a survey, an unofficial survey on our station, and it was 50-50, literally, very close to, of whether parents want them open or closed. I think it's just a very emotional issue, and there is no right or wrong. And I was speaking with epidemiologist Colin Furness, and he also said regional would be a good idea. And he basically said, thank God I'm not the one making the decision. It's a really tough decision.
Cynthia Mulligan and Dr. Isaac Bogoch, thank you so much for your time. We really appreciate your insights tonight. Thank you.
My pleasure. Have a great day.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.